Welcome to our video tip on taking the perfect message. This is Wendy Myers with Communication Solutions for Veterinarians in Denver, Colorado, and we specialize in helping veterinary teams with what I like to call the 3 C's: communication skills, client service, and compliance. We are one of the largest phone skills training providers in the veterinary industry, and you can get more information on our training programs, books, and webinars at csvets.com. I'm going to go through 3 quick tips with you today. First is how to screen calls so that pet owners get immediate answers. We'll also look at the steps to take an absolutely perfect message. And then the third one is what to say and how to respond if a caller is vague and doesn't want to give you the details of what they're calling about. Well, when a pet owner calls and asks to talk with the veterinarian, oftentimes, in fact, I will tell you probably 99% of the time, the doctor's not immediately available. You know, they're in the middle of performing surgery or doing dental procedures or ultrasound. They might be in back-to-back exams. In fact, might even be double booked today. It could be literally hours or almost the entire day before that pet owner's call can be returned. So when someone calls and asks to speak with the doctor, your very first approach is to screen calls in a way that can provide immediate service. So if the doctor is not available, I would encourage the client service team to ask questions to see if a technician or another member of the medical team can provide answers right now. And this is not only better client service, but it's also best for patient care. So let me give you an example. I have a cat named Opus who's 5 years old, and let's say that I bring him to your veterinary hospital for a dental procedure, and he has a couple of extractions, and as a result, you send me home with some oral antibiotics and oral pain medication with the instruction to give him his first dose tomorrow morning. So I go to do that the next morning. I wrestle with my poor little kitty, and he wins, and he will not take his medicine. I then call and ask to talk with the doctor. Well, the doctor is in surgery, and so what I would have the client service representative say to me is, Wendy, the doctor will be in surgery until 1 o'clock. What is your specific question for her? Because one of our technicians can likely help you right now. And if I would explain that I'm struggling to get my cat to take a pill, immediately I could have a member of the technician team answer that question. This is better client service because I get help right now, and it's honestly best patient care because I then get instruction over the phone and successfully give him his pain medication, and that then prevents hours and hours going by where my pet would be in physical pain before the doctor's able to reach me back. But let's say that I have a more detailed medical question and I do need to speak with the veterinarian. So now you're going to need to take a message. So let's walk through what are the elements of a perfect message. The receptionist will first want to note the time and date that the client called. And this is important because when the doctor finishes surgery, she's first going to return any messages flagged as urgent, and then secondly, the oldest to the newest message. You'll want to include the details of what the person was inquiring about, so then the doctor can either have the lab test results in front of her, the patient's medical record, any details that she needs to discuss during the call. I also like to get multiple phone numbers for the client if available, so maybe a cell number, a work number, a home number. Cell is always my first choice because the research shows that 98% of us with a cell phone always have it with us, and this is going to prevent phone tag. Now, if you capture a cell phone number, just don't write it down on the paper message. Also look in the practice management software and make sure that it gets entered there, because I like to think of the practice management software as the home base where the latest, most up-to-date information for that client is located. Also ask the caller the best time to return her call because you want to know when she's available, and then put your name or initials on it. So should the doctor have questions about the details of the message, she knows which team member to go to before returning the pet owner's call. And then if you have paper charts, you're going to want to pull that medical record and clip it to the message so that way the doctor can write the details of the conversation down when she phones me back. You also want to set expectations as you're finishing taking that message and explain that I will give the doctor your message when she finishes surgery at 1 o'clock today, and then I will also let the doctor know that you shared with me that it's best to reach you after 3 o'clock on your cell phone, and then I would repeat that number, just confirming that you have it accurate. Now, what should you do if a caller is vague? In fact, I will tell you, a few of us have some high maintenance clients who may say, oh gosh, she'll know what I'm calling about. Well, according to the American Veterinary Medical Association, the average small animal veterinarian has 1,200 clients, and the average pet owner has 1.5 pets. So that could be 2,400 patients or more, and it's just humanly impossible to remember the details of 2,400 patients. And a vague message is going to result not only in poor client service, but it's going to be incredibly frustrating to the doctor. I want you to keep in mind that every client is tuned into what I like to call is WIFM. What's in it for me? Why should I tell you the details of why I need to talk to the doctor? So I've put some key phrases in red for you, and this is using benefit statements. What's in it for me? Why should I explain to you the details of what I need? You're going to reply with, well, the doctor has asked me to note your specific question on the message. That way she can have your pet's medical record in front of her and be prepared to answer your question. This will help her respect your time, and this really makes it a client-centered conversation. I hope you found our tips on taking the perfect message helpful. You can get more details on our phone skills training programs, our books, and our monthly webinars at csvets.com.